Hello everyone and welcome to another episode of Magic Pill Monday, where we look at all kinds of supplements to see if they are worth buying, if they can help you with some sort of health condition, or if they can improve your performance based on scientific evidence, or if they're going to be a waste of money. And today we're looking at Boswellia extract. Now, what is Boswellia extract and why would you want to take it? Now, Boswellia is also known as frankincense, and it's actually a resin that comes from a tree, kind of like this. And it's been used for centuries, both for its medicinal properties, but also, as the name suggests, it has been used as incense. And the resin can be burned kind of like this, and it has a very pleasant smell. It's often used in religious circumstances. Now, this is a relatively obscure supplement. There's not a lot of research on it, but it has some very interesting potential benefits that I would love to show you today. So these are joint pain, asthma, cancer treatment and prevention, and skin health. Now, as usual, I will put the timestamps for this video down below in the description. I want to respect your time, so please feel free to jump to any part of the video that you think is interesting specifically for you. You don't have to watch the entire video if you don't want to. All right, so let's dive into the science on Boswellia. So the first benefit of Boswellia I want to talk about is joint pain, because this is the most researched benefit of Boswellia extract. We have 3 randomized control trials that look at how Boswellia can potentially improve joint pain. And it has been specifically studied on people that have a joint disease called osteoarthritis, and specifically in the knee joint. Now, in this research, they were taking about 100 milligrams a day, and they were taking it either for a month or up to 3 months. Now, you may see here aflapin and also 5-loxin. Those are 2 patented forms of Boswellia that I will talk about later to show you exactly what that is. However, it is just a form of Boswellia, and they used 100 milligrams a day. And they saw the following outcomes: improvement in the knee function, less stiffness in the knee, and also less pain. And this was assessed using the visual analog scale. So people just have to judge their pain based on a scale from 0 to 10. And they saw that on average, people taking Boswellia had a significant improvement in terms of pain compared to the placebo group. So that's benefit 1. Now, of course, they were researching it specifically for the knee joint, but it is quite likely, seeing that it improves pain, stiffness, and function, that it might work similarly for other joints as well. And it also might work for you, not just if you have osteoarthritis, but also if you have other sorts of joint pain or problems. The next benefit of Boswellia worth talking about is that it can help people with asthma. And they were researching this on 40 asthma patients, giving them 300 milligrams of Boswellia 3 times a day, so a total of 900 milligrams. And they saw that 70% of the patients taking Boswellia had improvements compared to only 27% on the placebo. And these are improvements such as less shortness of breath, less rattling of the lungs, and a lower number of attacks. So definitely a significant improvement in terms of well-being for people with asthma. But as I just said, for joint pain as well, it might be that Boswellia is not just beneficial for people with asthma specifically, but it can also be beneficial potentially for people with other lung problems or disorders. So if you are a person that has problems with breathing, problems with your lungs, but you are not asthmatic, you can still try the supplement and see if it can benefit you. Benefit number 3 is skin health. And in this research, they had 15 women apply a cream every day for 30 days, and that cream contained 0.5% boswellic acids, which is a component in Boswellia extract. And what they saw in the women that applied this cream was improved skin elasticity, lowered sebum excretion, which basically means less oily skin, and also they saw that the skin appeared younger. There were less wrinkles and roughness in the women that were applying the cream with the boswellic acids. So very interesting there indeed. It seems to have a rejuvenating effect on the skin. And the 4th benefit is, in my opinion, the most interesting, but also unfortunately the least researched, especially in humans. And that is that Boswellia shows great promise in being able to prevent or combat cancer. And here we have the only study that I know of done on humans, which is not really a study, it is a case report. And it is one woman, and she had breast cancer, and this breast cancer had metastasized to her brain. So here we see some CT scan images of her brain, and you can see, I think those lighter parts show maybe some tumors or some cancer activity. Now, in her case, they gave her 3 times 800 milligrams per day of Boswellia for 10 weeks straight, and then they did another CT scan, and as you can see clearly, even if you're not a medical professional, there's a huge difference between those images on the right here and those images on the left, and all her metastasized cancer in her brain had disappeared. So this is a very cool study that shows that Boswellia could potentially actually help people get cured from cancer, which is amazing, of course. Now, as I said, this is the only study that I know of or case report that I know of in humans. However, this has been researched far more extensively in rats and mice. And I have here a quote from the website examine.com. I will put the link for that in the description. And it says, Boswellia can potently suppress tumor growth in the pancreas and in the colon, and in some cases actually outright prevent tumor growth in the prostate and in the glioma. And the hypothesized mechanisms of action that Boswellia has are that it can stop cancer cells from multiplying, it can prevent cancer from growing blood vessels so it can spread, and it can also prevent cancer to invade cells. Now, all of this information can be found, as I said, on examine.com, where you can also find the accompanying studies and much more detail, but I didn't want to make this video too complicated and dive too much into the details. But I just want to show that there is some very promising research on Boswellia and how it can prevent or treat cancer in animals, and one case study in humans with also miraculous results, I would say. Now, the dosages that they use to prevent cancer or to treat cancer, if you calculate them to human equivalents, then we end up with dosages around 8 milligrams per kilogram of your body weight up to 60 milligrams per kilograms of your body weight. So if you know somebody that has cancer, or if you are afraid of cancer, this might be something to consider either as a preventative method or as an addition to any treatment you are currently taking. And it's definitely something that you can discuss with your physician, with your doctor. Of course, this is totally not medical advice. This is just presenting you some very interesting information that I found when researching Boswellia. Now, when it comes to risk and downside, Boswellia is also great because I don't know of any side effects of Boswellia. It seems to be a very safe supplement. Now, let's talk a little bit about the quality and the dosage of all the Boswellia supplements around. And I think this is actually very important because there are a lot of different products out there and it can get a little bit confusing really quick. So, of course, Boswellia itself is just a resin. But within the resin, there are different molecules that people suspect are the molecules that are responsible for the beneficial effects of Boswellia. We call those boswellic acids. And the one that seems to be the most promising in terms of beneficial effects is this one. And it is abbreviated as ACBA. The name is too difficult for me to pronounce, so I will just use the abbreviation called ACBA. Now, there are also other boswellic acids in Boswellia that might also have their own unique benefits for our health. So there are several products on the market, and we already saw two before, which are 5-Loxin and Aflapin. Those are patented products of Boswellia, and they are standardized to have a certain percentage of this very beneficial boswellic acid called ACBA. So 5-Loxin has always 30% ACBA, and Aflapin always has 20% ACBA, but also has been produced in a certain way such that it has enhanced bioavailability. Now, besides these patented forms, there are also regular supplements on the market, and they usually say we have a certain percentage of boswellic acids, which is a mix of all of these, including ACBA, but also all the other boswellic acids. Now, the dosage that you need to take kind of seems to depend on what supplement you have. So if you are taking a patented form of Boswellia, you can get away with only 100 to 250 milligrams a day, according to the research that we have available right now. However, when you take only the resin, so you have a mix of boswellic acids, some dosages can even go up to 6,000 milligrams per day, divided into 3 doses. So depending on which supplement you have to consider a different dosage. At least that is what the science currently suggests. So here are some examples of supplements that you could find on the market. For example, here on the left, we have an example of the 5-Loxin supplement. So when you see this in the store, you know for sure that it's going to have this 30% of those ACBA, boswellic acids. So that is a high quality supplement. However, the one in the middle here is an example of a supplement that you're better off avoiding. It says Boswellia on the label, but it doesn't say anything about the percentage of boswellic acids, which are the compounds responsible for the positive effects of Boswellia. So it might be that this contains a very low percentage or a very high percentage, but we simply don't know. Now here on the right, we have an example of a supplement that doesn't standardize specifically for ACBA, but it's standardized for boswellic acid. So we see here standardized to minimum 65% boswellic acid, and that will be the mixed boswellic acids as we saw on the previous slide. Now, as you can see also here, the dosage is far higher than the dosage of this supplement. So it does seem at least that when we have a normal Boswellia extract with mixed boswellic acids, we have to take a higher dosage than if we have a patented form like 5-loxin. And if you see a supplement like this that doesn't specify anything about the percentage of boswellic acids, I would personally not buy it. Now, the final verdict on the supplement, I would give this supplement a 7 out of 10. I think it has huge potential for cancer, which is absolutely great. There are not a lot of supplements that seem to be able to help people with cancer, and I'm just very curious to see how that research might develop. Now, it also has great overall health benefits for the skin, for joints, for lungs. However, the scientific research is still quite weak. So I would like to see more research confirming these benefits before I am very sure about this supplement. And also, as we talked about just now, the supplement quality and the dosage regimens are all over the place. They are a little bit chaotic, they're difficult for people to understand. And I think the chance is pretty high that people will end up with a low quality supplement or simply do not take the right dosage because it's so confusing. So all overall, I think that deserves a 7 out of 10, and that can definitely become higher in the future if these problems are going to be fixed. That was it for today. If you like this video, please leave a like. If you want to see more of this kind of videos, subscribe to the channel. And if you have any questions or suggestions for future videos, just leave a comment below and I will absolutely get to it. Thank you so much for watching. Bye bye.